Hello, everyone. Welcome back to another assessment for our aspirants for CAA, still on anatomy and physiology. We shall continue where we left off last time. And for the rest of the session, we're going to be discussing the muscular system. Sir Jobel, good afternoon. We now take up upper limbs, specifically the muscles of the arms. Okay, let's describe number 19. This is pointing to
Number it's pointing to the abductor pollicis longus.
okay. And the biceps brachii is what number?
Uh, number 1.
Yes. This is what people want to show off, no? Number 12 is
12 is the extensor carpi ulnaris.
flexor
Carpi
carpi radialis is what?
is number 7.
Great. What about number 11 here?
The flexor carpi ulnaris.
So it's on the ulnar side. So from the name, you would
Ulnar.
know that it flexes the wrist on the ulnar side. No? Number 18 is pointing to
Number 18 is the extensor carpi radialis brevis.
okay, brevis means short. The brachialis, it's indicated by what number?
Indicated by the number 2.
Number 16 is pointing to
The brachioradialis.
okay. Number 14.
It's the extensor digitorum.
Okay. Flexor pollicis longus.
It's number 5.
Yes. Brachioradialis is what number?
Number 3.
Number 15 is
Uh, the triceps brachii.
flexor digitorum superficialis is what number?
Number 4.
Number 13 is
The extensor digiti minimi.
digiti minimi, little fingers. Pronator teres is what number?
Number 6.
Palmaris longus.
It's the number 8.
Number 10 is
The anconeus.
flexor carpi ulnaris is
Number 9.
number 4 is
The flexor digitorum superficialis.
what about the extensor digitorum? What number?
It's the number 14.
Number 17.
The extensor carpi radialis longus.
So it's the longer version.
Longer.
The extensor carpi radialis brevis, so this is the shorter version, is number
18.
number 1 is the one that guys
Uh,
usually show off.
uh, biceps brachii.
Number 2,
Brachialis.
extensor carpi radialis longus.
Number 17.
Brachioradialis.
16.
Number 3,
Brachioradialis.
Triceps brachii.
Number 15.
Extensor digiti minimi.
Number 13.
Number 5 is
Flexor pollicis longus.
number 6.
Pronator teres.
Extensor digiti minimi. Nice name.
Number 13.
Number 7.
Cute. Flexor carpi radialis.
Number 8.
Palmaris longus.
The extensor carpi ulnaris.
It's number 12.
Flexor carpi ulnaris.
Number 11.
Anconius.
Number 10.
Abductor pollicis longus.
19.
Number 9.
Number 9, flexor carpi ulnaris.
Number 18.
The extensor carpi radialis brevis.
Brachialis.
Number 2.
Number 16.
The brachioradialis.
Number 3.
Brachioradialis.
Brachioradialis is what number?
16.
Triceps brachii.
15.
Okay, I remember in medicine, we have the whole year identifying all the parts. So this is usually the first because this is very near the skin, no? So you have to memorize all the muscles. And during the practicum, they would just show the muscle with some bone. Yeah, ganon. I remember. Okay, practical example. Yes. So for those who would like to pursue medicine, that's
Kaya pala
part of
sabi no, my niece, mahirap daw yung ano. She's taking up magme-medicine kasi.
Hmm.
Sabi niya mahirap daw.
Yeah, it's better sa book, but when you see it actual, they don't actually look the same. Una-una because of the formalin, umiitim na yung muscle, iba yung itsura. But again, it's just the feel, the shape. And of course, you need to know the location talaga. No? And sometimes like this one, the origin, the insertion, like origin of this muscle, you have got to identify it. So if you don't know the muscle, so everything is wrong. Identify the muscle, then its origin, ganon. And you have to think fast, so to also study fast. So it's more of like repetition lang, kaya the style now is more on repeat. Now let's go to the origins and insertions of the muscles of the arms. The origin of the biceps brachii is
the coracoid process of the scapula and the supraglenoid.
the insertion of the extensor carpi ulnaris is
the base of the fifth metacarpal.
so you know the difference between the origin and the insertion. Origin, ito insert. Origin to, this is insertion. So papunta siya sa ulnaris. Next, the radial tuberosity and bicipital aponeurosis into the deep fascia on the middle part of the forearm form the insertion of which muscle?
The biceps brachii.
Great. What is the insertion of the brachioradialis?
It is the distal styloid process of the radius.
See? Easy, no? You see that?
I know.
Radius yan eh. The lateral supracondylar ridge of the humerus is the origin of
the brachioradialis.
The origin of the extensor carpi ulnaris is the
lateral epicondyle of the humerus and the posterior border of the ulna.
Infraglenoid tubercle of the scapula and dorsal surface of the humerus form the origin of the
Triceps brachii.
origin of the extensor digitorum. So ito yung origin. So you have to know. So you will not be able to identify the origin if you did not take up the skeletal system. Diba? Oh.
Mhm.
So what's the answer? So we all know this is the humerus.
It's
That
the
the humerus,
lateral
the humerus ito. Sorry.
lateral epicondyle of the humerus.
This is the epicondyle, no? And this is the humerus.
Epicondyle.
The humerus is the counterpart of the femur, and the femur is the largest bone in the body. The middle and distal phalanges of the second to fifth fingers form the insertion of
Extensor digitorum.
the flexor carpi radialis is
The bases of the second and third metacarpal bones.
the middle of the volar surface of the radius and the adjacent interosseous membrane form the origin of which muscle?
The flexor pollicis longus.
The origin of the palmaris longus is
The medial epicondyle of the humerus.
so kanina it was the lateral, no? Do you still remember the muscle there? Now it's the medial. Okay. What is the insertion of the flexor pollicis longus?
It is the base of the distal phalanx of the thumb. Distal
Okay.
phalanx.
So hinihila yan. So you flex the, what's this? It's the longer version that flexes the thumb. See, you flex your thumb. You flex your thumb. That's the flexor pollicis longus. What about the
Oh.
insertion of the palmaris longus?
The palmar aponeurosis.
Yes, this one, no? You see it, no? Without the picture, you won't be able to, especially when you see it actually. What is the insertion of the
Mm-mm.
triceps brachii?
The olecranon process of ulna.
Okay. Olecranon process of the ulna.
Okay.
Next, what is the origin of the abductor pollicis longus?
The ulna, radius, and the
Interosseous.
interosseious membrane.
The lateral supracondylar ridge of the humerus is the origin of the, sounds familiar, di ba? Kanina yan.
Extensor carpi radialis longus.
The insertion of the abductor pollicis longus is the
Base of the first metacarpal.
what is the origin of the anconeus?
The lateral epicondyle of the humerus.
Now you know. This is the humerus, the lateral epicondyle, and then the medial epicondyle. The lateral surface of the olecranon and the distal posterior ulna form the insertion of which muscle?
The anconeus.
The origin of the extensor carpi radialis brevis is the
Humerus at the anterior of lateral epicondyle.
what is the insertion of the brachialis? Ito. What?
The coronoid process of the tuberosity of the ulna.
Okay. So if this is the ulna, this is the radius, di ba? Nasa ulna siya. What is the insertion of the extensor carpi radialis brevis?
The posterior base of the third metacarpal.
The insertion of the flexor carpi ulnaris is?
The pisiform.
Yes. Nice name, no? Would you like that as a name for your son? Pisiform. What is the origin of the brachialis?
The origin is the anterior surface of the humerus, especially the distal half.
Okay. The origin of the extensor digiti minimi is the
The anterior portion of the lateral epicondyle of the humerus.
So basta lateral yan, it's the thumb. No? Remember the anatomical position. What is the insertion of the flexor digitorum profundus?
The base of the distal phalanges of their fingers.
What is the origin of the flexor carpi ulnaris?
The medial epicondyle common flexor tendon.
The dorsal base of the proximal phalanx of digit 5. The extensor expansion is the insertion of what?
Extensor digiti minimi.
The upper surfaces of the ulna and the interosseous membrane and deep fascia of the forearm form the origin of which muscle?
The flexor digitorum profundus.
Now let's go to the actions of the muscles of the arms. So we're done with location, the origin and insertion, then the action. Grabe, no? Okay. Action of the abductor pollicis longus is to abduct the thumb. True or false?
True.
Yes. How do you abduct the thumb? Away or towards the center?
Towards the
Away.
center.
No, abduct,
Away. Sorry. Away.
going away from
Abduct.
the midline. No?
Away.
The action of the
Abduct.
acroneus is to
Support the elbow joint and assist in its extension.
0. No? The elbow joint is supported and assisted in the extension by the action of the
Anconeus.
anconeus is to flex the elbow and supinate the forearm. True or false?
False.
The main actions of the biceps brachii are to flex the elbow and supinate the forearm. True or false?
True.
The main actions of the biceps brachii are to
Flex the elbow and supinates the forearm.
see. Can you do it? Okay. The elbow is flexed by the action of the
Biceps brachii.
The action of the brachialis is to abduct the thumb. True or false?
False.
Because the brachialis is to strongly flex the forearm. It flexes the forearm at the elbow joint. The action of the brachialis is, I just said it earlier.
Flex the elbow joint.
Yes. Flexion of the elbow is assisted by the action of, ang kulit, no?
Brachial.
The action of the extensor digitorum is to extend the forearm. True or false?
False.
Okay. Actually, it extends the finger, no? And metacarpophalangeal interphalangeal joints, 2 to 5. 2 to 5 siya. Now, the action of the brachioradialis. Yan. What is the action?
To flex the forearm at the elbow.
Okay, can you feel now your brachioradialis? I'm sure si Madam M, finil na niya kanina pa yan. Di ba, Madam M?
Yes.
Yes, I've been monitoring your
Hello.
post. The elbow is, naka-vacuum pa, no? Wow. Showing the brachioradialis.
Yes.
Okay, the elbow is flexed by the action of,
Brachioradialis.
yun lang din kanina. The action of the flexor carpi radialis. Remember the name, flexes the radial side of the wrist. No? So true or false?
It's true.
Yes.
It's true.
Flex and abducts the wrist. Diba? The action of the flexor carpi ulnaris is to flex the thumb.
False.
Ang thumb should be pollicis, right? Pollicis longus, right? Remember, ulnar side of the wrist. Yeah. Diba? Flexes the thumb. Okay. The head is extended and abducted by the action of the
Extensor carpi radialis brevis.
action of the brachioradialis is to flex the forearm of the elbow. Paulit-ulit. True or false?
True.
Yeah.
True.
Siguro we should show this, no? Next time siguro. Okay, show the action. Perform. Okay. The main, demonstrate. The main action of the triceps brachii is to
Extend the forearm.
okay. Forearm. Okay, paulit-ulit. Forearm is extended by the action of the
Triceps brachii.
the action of the extensor carpi radialis brevis is to extend the forearm. True or false?
False.
It abducts. Remember, extend yan na. It abducts the hand. Ano, it causes, yeah, it extends the hand. Kaya nga extensor eh. The hand, not the forearm. Diba? Action of the extensor carpi radialis brevis is to
Extend and abduct the hand at the wrist joint.
so the carpi or carpus is wrist. The hand is extended and abducted by the action of the
Extensor carpi ulnaris.
action of extensor carpi radialis longus is to extend and abduct the hand at the wrist joint. True or false?
True.
The action of the extensor carpi radialis longus is
Extend and abduct the hand at the wrist joint.
the fingers are flexed by the action of the
Flexor digitorum superficialis.
action of the extensor carpi ulnaris is to extend the little finger. True or false?
False. False.
So, hindi siya finger ha. Ano ba yung little finger? Anyone? Sir Jobel, what's the little finger? Digiti minimi, di ba? Yun yung magiging
Yeah.
pangalan ng aso mo, Digiti minimi. Gustong-gusto ko itong pangalan.
Ang cute nga.
So actually, the extensor carpi ulnaris from the name will cause extension of the hand, extension and adduction. Action of the extensor carpi ulnaris is to
Extended adduct.
Yes, at the
The
wrist
hand at
joint.
the wrist joint.
The hand is extended and abducted by the action of the
Extensor carpi radialis longus.
action of flexor digitorum superficialis is to flex the fingers. True or false?
True.
Thumb is flexed by the action of the
Flexor pollicis longus.
the wrist is flexed and abducted by the action of the
Flexor carpi radialis.
action of flexor carpi radialis. Ang kulit, no? Is to
Flex and abduct the wrist.
thumb is abducted by the action of the
Abductor pollicis longus.
action of extensor digiti minimi is to extend the little finger. O, di ba your favorite name?
True.
So, can you show us how to do it? Pag ayaw mo makita na you were picking your nose. No, parang hindi obvious. Yan ba ginagamit? Extensor digiti minimi. Parang ang daming nakatakip. Okay, kunwari pa nakatakip. Yung pala, ginagamit
Depende
yung
po yun
extensor
sa size ng
minimi. O, diba? At
depende
least
po yun
social,
sa size ng butas ng ilong.
yeah, nangungabutas. Para mas medyo social. I'm
So,
using my, I'm
My
flexing,
digiti
I'm
minimi.
extending my digiti minimi. O, diba?
Minimi.
The action of the flexor carpi ulnaris is
Flex and adduct the wrist.
Okay. Okay, Sir Joe Bell, what muscle extends the little finger? Yung kanina, na ano na? Yung favorite name. Ay, ano ba yan? Okay. Extensor digiti minimi. The wrist is flexed and abducted by the action of the
Flexor carpi ulnaris.
palmaris longus is to
Flex the wrist.
hand, wrist, and fingers are extended by the
Extensor digitorum.
action of flexor carpi ulnaris is to flex the thumb. True or false?
False.
No, it flexes the what? The wrist.
The wrist.
Remember, carpi. Action of the abductor pollicis longus is to
Abduct the thumb.
the little finger is extended by the action of the di ba dyan na naman? Favorite.
Extensor digiti minimi.
Pag no speaking, di ba? Social pa. Yung pala, ang pangit kasi pag ginamit mo Tagalog, no? Okay. The action of the triceps brachii is to flex the forearm. True or false?
False.
Okay. Extend the forearm. Action of the flexor, tingnan nyo, pollicis sa thumb yan, is to what? Anong ginagawa dito?
Flex the thumb.
Yes. Wrist is flexed by the action of the
Palmaris longus.
action of palmaris longus is to flex the wrist. True or false?
True.
Action of extensor digitorum is to
Extend the hand, wrist, and fingers.
hand, wrist, and fingers are extended by the action of the inulit lang.
Extensor digitorum.
Action of flexor digitorum superficialis is to flex the fingers.
True.
Diba? That's why when you use the points doon, dito sa, these points here. Dito pa? Dito ba yun? Ang ganda ng effect niya. Action of the extensor digiti minimi is to
extend the little finger.
little finger is extended by paulit-ulit.
Extensor digiti minimi.
Hanggang saya na magiging pangalan ng susunod mong anak. Okay. Action of the flexor pollicis longus is to flex and adduct the wrist.
False.
Yeah, it flexes the... Okay, Sir Joe Bell, anong finiflex dito? Pollicis is what? Bilis. Nako.
Thumb.
Flexes the thumb. Okay. Action of the flexor digitorum superficialis is to
flex the fingers.
Fingers are flexed by the action of the... Napansin niyo pa ulit-ulit.
Flexor digitorum superficialis.
Okay. Action of the flexor carpi radialis is to flex and abduct the wrist. True or false?
True.
Action of flexor pollicis longus. Answer, Sir Joe Bell. Anong action ng flexor pollicis longus?
Flex the thumb.
Flex the thumb. The thumb is flexed by the action of the
flexor pollicis longus.
Hanggang sa mabingi ka na. The action of the flexor carpi radialis is to
flex and abduct the wrist.
Flexion of the elbow is assisted by the action of the
brachialis.
action of extensor digitorum is to extend the forearm. True or false?
False.
What does it do? Extends the
Extends the
ano ba
fingers.
fingers. Very good.
Fingers.
Main action of the
Fingers.
triceps brachii is to
Extend the forearm.
okay. Actually, it's easy, no, anatomy. Medyo nakakaano lang ang mga names.
Names.
Parang, ano ba tawag?
Tongue twister.
Tongue twister.
Mm.
Nakaka-diarrhea, no? Oo. No, nakaka-nosebleed. Okay.
Ano, sometimes they are named after doon sa kung ano yung purpose
Yung
nila.
na-discover.
Saka sa location mismo. Kaya madali siyang malocate.
Mhm. Ano yung mga Latin ba yan? Latin yata ito, no?
May Latin or halo-halo po. May Latin, may
Latin.
Greek.
Oo. Ayaw nila ng French, no? Joke.
Ayaw nila.
Lalong sumakit yung ulo.
Kasi mahirap kasi. Mahirap na isulat, mahirap pa
Oo.
magbigkasin.
Okay. So lower limbs, muscles of the legs na tayo. Number 17.
It's the flexor digitorum longus.
O, di ba? Meron siyang counterpart sa ano, di ba?
Leg.
Yeah.
So,
The
upper
tensor
limb.
fasciolate is indicated by number
1.
para namang
Fasciolate.
coffee yung parang latte.
Latte.
Number 9 is pointing to
Fibularis tertius.
mga tongue twister, no? Number 16 is
The soleus.
sartorius is what number?
Number 2.
Okay, nakaganon siya. O, tingnan mo. It's the only muscle na nag-diagonal. Sartorius. Number 15 is pointing. You try stroking that area. The sartorius.
I'm touching it.
Oo. So ngayon, alam niyo na yung muscle. Okay.
Yun lang yung nakadayan.
Number
15 is gastrocnemius.
yeah. Actually, kitang-kita yan sa mga runners. Yeah, gastrocnemius. Rectus femoris is what number?
Number 3.
Yeah, rectus femoris. Number 14 is
vastus medialis.
extensor digitorum longus is what number? Yung kanina.
Number 8.
Iliotibial tract is indicated by number
4.
Number 13 is
Adductor magnus.
so it's called adductor magnus. It's a very strong adductor. Magnus eh. Parang ice cream. Ay, ipa pala yung ice cream. Siguro yun. The vastus lateralis. Magnum pala yun. So,
number 5.
okay. Vastus lateralis. Number 12 is
The gracilis.
yes. Fibularis longus is what number?
Number 6.
Then, okay, kaya alam mo na fibularis longus, fibularis tertius. Number 10 is?
Tectinius.
Number 11 is?
Adductor longus.
Tibialis anterior is what number?
Number 7.
Fibularis tertius, repeat na to ha. Fibularis tertius is what?
Number 9.
Flexor digitorum longus is what number?
17.
Number 1 is
The tensor tracheae latae.
number 8 is
The extensor digitorum longus.
so now you know how it works, no? Ito yung digits, diba? So it extends the toes, right?
Yes.
Pectineus is what number?
Number 10.
Yeah, this one. Number 7 is
Tibialis anterior.
adductor longus is
11.
sinong katabi niya?
Si pector.
Pectineus.
Pectineus.
Oh, sino to si number 12? Sir Jobel, sino si number 12? Naku ha. Yung parang ice cream ang tunog. Ay, hindi pala. Magnum pala. Adductor magnus. The soleus is what number?
16.
Number 6 is, there.
Fibularis longus.
Gracilis is what number?
12.
Ito pala yung adductor magnus. 12 yung gracilis. Sorry. Kanina ha. Sorry. This is gracilis. Number 5.
Vastus lateralis.
Adductor magnus.
13.
Yeah, this one. Sa loob. This one is gracilis. Sorry for that. Baka mayroon tayong basher. Meron pa naman nag-one pa. It's not internal. Yung kamali sa external. Internal daw. Talagang tinignan. Okay. Fine. Kasi nakasulat internal. Grabe yung mga
Basher.
No, actually, naman, we're open to corrections. We're
Yeah.
only humans. Number 4 is
Iliotibial tract.
number 2. Nakaganyan, Remember?
Sartorius.
Vastus medialis is what number?
14.
So if 14 is vastus medialis, what is number 5? Vastus lateralis. This one is Sir Jobel. What is this? Sartorius. And this one, in front of the femur, rectus
femoris.
And so if this is rectus femoris, what is this? Hindi pala sila What is number 7?
Anterior tibialis.
Wow, tibialis anterior. Very good. Bawi talaga. Ikaw na susunod, Sir Jobel. Oo. You will take care of the next one. Sige. The gastrocnemius is what number?
Number 15.
Yan. So, check your gastrocnemius. Kung hindi ka naglalakad, hindi ito firm. Kaya, naglalakad na ako.
Oh, no.
Sige, you'll see.
Oo nga, no?
Hindi siya mag-firm pag hindi ka naglalakad. Okay, thank you so much, Madam T.
Thank you.
Let's now proceed to, let's now welcome from Cadiz, Sir Jobel. Good evening.
Yes.
Okay, let's continue. Now we go to locations of the muscles of the legs.
Yes.
Posterior posterior to sa likod. Adductor magnus is what number?
Number 18.
Number 32 is what?
Fibularis brevis.
Gluteus medius. is what number?
25.
There. Gracilis, yung kanina, is what number?
19.
Number 31.
Fibularis longus.
Semitendinosus.
Number 20.
So this is it. Number 26 is what? Yung gusto ni-
Gluteus maximus.
Yeah. Gustong-gusto daw yan ni Sir Regel na anatomy.
Approved.
Yeah,
Approved.
remember. Number 30.
Soleus.
Yeah.
Soleus.
Semimembranosus is number
21.
good. Number 29 is
Vastus lateralis.
Sartorius. Nasaan si Sartorius?
Number 22.
Paano yung ano niya? Pag ganun, di ba? Oh. This is, you can actually feel your Sartorius if your muscles are toned. Okay. Flexor digitorum longus. Ay, ganito na lang. You go to the gym, you try to identify the muscle of the
Mag-execute po.
flexor digitorum longus.
Number 24.
Number 28 is
Biceps femoris.
gastrocnemius.
Number 23.
Number 27,
Iliotibial tract.
number 25,
Gluteus medius.
gluteus maximus again.
Number 26.
Number 18,
Abductor magnus.
number 24,
Flexor digitorum longus.
iliotibial tract. What number?
27.
Number 23,
The gastrocnemius.
gastrocnemius. No? Fibularis brevis is what number?
Number 32.
Biceps femoris.
28.
Number 22,
Sartorius.
vastus lateralis.
29.
Number 19,
Gracilis.
number 21,
Semimembranosus.
soleus.
Number 30.
Number 20 is what?
Semitendinosus.
Fibularis longus. What number?
Number 31.
Now let's go to actions. Action of tensor fascia lata is
Help stabilize the hip and knee joints.
okay. Nakikita nyo dito, oh. This is the knee joint. This is the hip joint. So take care of your tensor fascia lata. Kasi pag nasikat mo yan. So ano na mangyayari? Mahirapan ka na. Okay. Locate your tensor fascia lata. Hip and knee joints. Action of gastrocnemius. This one.
Plantar flex the ankle and flex the knee.
Okay. The sartorius, aside from flexing the knee, will also what?
Flex and laterally rotates the hip joint.
The action of the soleus is to
Plantar flex the ankle.
Okay, para ka nagtitiptoe, no? The action of the rectus femoris is to yeah, what's your answer?
Extend the knee, doc.
Action of flexor digitorum longus.
Flex toe. Toes number 2 of 5 and helps the plantar flexion.
Action of adductor longus.
Abduct and flex the thigh.
Action of vastus lateralis.
Extend the knee.
As well as being a powerful thigh adductor, the adductor magnus assists with
Flexion, extension, and lateral rotation of the thigh.
action of the fibularis or peroneus longus. So another name for fibularis longus is peroneus longus. Is to
Invert and plantar flex the foot.
gusto niyo ba yung ganyan sa practicum? We will demonstrate the action, identify the muscle. Do you find it exciting?
Hindi naman. Pwede.
Pwede, okay. That's the only way to learn. The action of the tibialis anterior.
Dorsiflex the ankle and invert the foot.
Action of gracilis.
Flex the knee and abduct the thigh.
Action of extensor digitorum longus.
Extend toes number 2 5 and flex the ankle.
Action of the pectineus is
Abducts the thigh and flexes the hip joints.
action of vastus medialis.
Extend the knee.
As well as being a powerful thigh adductor, the adductor magnus assists with
Flexion, extension, and lateral rotation of the thigh.
action of the fibularis or peroneus brevis is to
Invert and plantar flex the foot.
action of vastus lateralis.
Extend the knee.
Action of soleus.
Plantar flex the ankle.
Action of gracilis.
Flex the knee and abduct the thigh.
As well as medially rotating the tibia, the semimembranosus.
Extends the thigh and flexes the knee.
As well as flexing the knee, the sartorius also.
Flexes the laterally rotates the hip joint.
Action of gastrocnemius.
Plantar flex the ankle and flex the knee.
Action of fibularis or peroneus longus.
Invert and plantar flex the foot.
Action of flexor digitorum longus.
Flex toes number 2 and 5 and help the plantar flexion.
As well as assisting with the rotation of the thigh, the action of the gluteus medius is to
Abduct the thigh.
action of gluteus maximus.
Extend hip joint.
Action of biceps femoris.
Flex the knee and rotate the tibia laterally.
As well as medially rotating the tibia, the semitendinosus.
Extends the thigh and flexes the knee.
Action of vastus intermedius.
Extend the knee.
Action of adductor brevis.
Abduction and flexion of the thigh.
Action of flexor hallucis longus.
Great toe and helps to supinate the ankle.
Okay, so this is the counterpart of our flexor pollicis longus, no? Main action of the lumbricals of the foot.
Extend the toes and interphalangeal joints.
Action of psoas major.
Flex the laterally, rotate the hip.
Action of gluteus minimus.
Extend the hip.
Action of iliopsoas.
Flex the torso and tight.
Action of inferior gemellus.
Rotate the thigh laterally.
Laterally. Action of the obturator externus.
Rotate laterally and help abduct the thigh.
Main action of interossi, so the dorsal aspect, is to
Abduct the second and third and fourth toes.
main action of the interossei, plantar aspect, is to
Abduct the third, fourth, and fifth toes.
action of obturator internus.
Rotate laterally and help to abduct the thigh.
Action of peroneus tertius.
Dorsiflex, invert and abduct the foot.
Action of gemellus superior.
Laterally rotate and stabilize the hip.
Action of iliacus.
Medially flex and rotate the hip.
Main action of flexor digitorum brevis.
Flex the lateral four toes.
Main action of flexor hallucis brevis.
Flex the metarsophalangeal joints of the big toe.
Main action of piriformis.
Laterally rotate the hip joint.
Action of plantaris.
Plantar flex the ankle and flex the knee.
Action of popliteus.
Medially rotate the tibia.
As well as helping to adduct the hip, the quadratus femoris is
Rotates the hip laterally.
a main action of extensor hallucis longus.
Extend the big toe and foot.
Action of abductor hallucis.
Flex and abduct the big toe.
Action of flexor digiti minimi brevis. In the foot.
Flex the metatarsophalageal joints of the little toe.
Action of superior gemellus.
Rotate the thigh laterally and help abduct the thigh.
As well as inverting the foot, the tibialis posterior also
Abducts the foot and plantar plexus and ankle.
action of the articularis genu.
Retract the bursa as the knee extends.
Action of extensor hallucis brevis.
Extend the great toe.
Main function of tibialis posterior.
Foot.
Action of the abductor digiti minimi.
Flex the abduct and fifth toe.
Action of adductor hallucis.
Flex and abduct the big toe.
Now let's go to origins and insertions of the muscles of the legs. The gluteal tuberosity of the femur and the iliotibial tract form insertion of which muscle?
Gluteus maximus.
Origin of adductor longus.
Pubic body just below the pubic crest.
Insertion of rectus femoris.
Patellar tendon as one of the four quadriceps muscles.
Insertion of the adductor longus.
Middle third of the linea aspera.
What is the origin of the tensor fasciae latae?
The iliac crest.
Plantar surface and base of the distal phalanges of the four lesser toes describes the insertion of the
Flexor digitorum longus.
tuberosity of the ischium, linea aspera, and the femur form the origin of which muscle?
The bicep femoris.
What is the insertion of the tensor fasciae latae?
Iliotibial tract.
What is the insertion of the biceps femoris?
Lateral head of the fibula and the tibia condyle.
The origin of the tibialis anterior is?
Body of tibia.
What is the origin of the gastrocnemius? Ito.
The lateral and medial condyles of the femur.
Insertion of tibialis anterior.
Medial cuneiform and the first metatarsal bone.
Insertion of gastrocnemius.
Tindo and mid posterior calcaneus.
What is the origin of the flexor digitorum longus?
The posterior surface of the body of the tibia.
Gluteal surface of the ilium, lumbar fascia, and the sacrum form the origin of the
Gluteus maximus.
lateral condyle of the tibia, shaft of the fibula, and the interosseous membrane form the origin of which muscle?
The extensor digitorum longus.
What is the insertion of the gracilis?
The tibia or pes acerinus.
Dorsal surface and middle and distal phalanges of the lateral four digits are insertions of the
Extensor digitorum longus.
origin of the sartorius.
Inferior to the anterior superior iliac spine.
What is the origin of the fibularis longus?
The upper
Insertion of the sartorius.
anteromedial surface of the upper tibia in the pes anserinus.
Insertion of fibularis longus.
The first metatarsal and the medial cuneiform.
Origin of semimembranosus.
The ischial tuberosity.
Patella via the quadriceps tendon and the tibial tuberosity via the patellar ligament form the insertion of
Vastus lateralis.
origin of flexor digitorum longus.
Posterior surface of the body of the tibia.
What is the insertion of the semimembranosus?
The medial surface of the tibia.
Plantar surface and base of the distal phalanges of the four lesser toes forms the insertion of which muscle?
The flexor digitorum longus.
Greater trochanter intertrochanteric line and the linea aspera of the femur form the origin of the
Vastus lateralis.
What is the origin of the gracilis?
The ischiopubic ramus.
Fibula and the medial border of the tibia at the soleal line forms the origin of
Soleus.
the lateral tuberosity at the base of the fifth metatarsal bone forms the insertion of which muscle?
The fibularis brevis.
Origin of semitendinosus.
Tuberosity of the ischium.
What is the insertion of the pectineus?
The pectineal line of the femur.
Origin of fibularis longus.
Upper lateral shaft of the fibula.
Insertion of semitendinosus.
Fish Arcerinus tibia.
What is the origin of the pectineus?
The pectineal line of the pubic bone.
Insertion of the fibularis longus.
The first metatarsal and the medial cuneiform.
Fibula and the middle border of the tibia at the soleal line forms the origin of.
Soleus.
What is the origin of the fibularis tertius?
The distal anterior surface of the fibula.
What is the insertion of the soleus?
The tendocalcaneus.
Insertion of fibularis tertius.
Dorsal surface of the fifth metatarsal.
Origin of vastus medialis.
The medial side of the femur.
Gluteal surface of the ilium under the gluteus maximus forms the origin of.
Gluteus medius.
Insertion of vastus medialis.
Quadriceps tendon.
Insertion of the gluteus medius is.
Greater trochanter of the femur.
Okay, let's now go to muscle anatomy, the structure of muscle tissue. Number 9 is.
Perimysium.
A muscle's elasticity is its ability to.
Return its original length after contraction.
What does number 6 indicate? What is this?
Tendon. Tendon, number 6.
Adductor is a skeletal muscle which.
Moves a limb towards the midline.
What does number 8 indicate?
Fascicle.
Which number indicates example of cardiac muscle? 10, 11, or 12?
Number 12.
Which type of muscle is stimulated by nerve impulses from the brain and spinal cord?
Skeletal.
Which number dito? This is cardiac, di ba? So ano ito? Skeletal. Number 10.
Skeletal.
Which number indicates the main skeletal muscle?
Number 2.
Yes. Which number dito represents it? 10, 11, or 12?
Skeletal is number 13.
Skeletal muscle is attached to bones by.
Tendons.
Which number indicates an example of skeletal muscle?
Number 10.
Where on the body would you find the trapezius?
On the back.
The muscle around the eye is called.
Obercularis oculi.
The main muscle involved with chewing is.
Masseter.
How many main types of muscle tissue are there?
There are 3.
Which type of muscle is also known as
3.
voluntary muscle?
Skeletal.
Number 11 is.
Smooth muscle.
Periosteum is indicated by number.
Number 1.
Which number indicates the epimysium?
Number 3. Number 3.
Epimysium, mysium is muscle. No? A muscle fiber is indicated by what number?
Number 4.
What is the name of the large muscle at the back of the calf? Yung kanina.
Gastrocnemius.
Gastrocnemius. Which of the following muscles turns the head?
The sternocleidomastoid.
A muscle's contractility is its ability to
contract forcefully when stimulated.
What does number 5 indicate?
Myofibril.
Which of the following muscles acts as antagonist to the biceps brachii?
Triceps brachii.
Which type of muscle is sometimes called involuntary muscle?
Smooth muscle.
The outer layer of connective tissue which surrounds skeletal muscle tissue is called
Epimysium.
epimysium. Which type of involuntary muscle has branched striated fibers?
Cardiac.
Number 7 is
Endomysium.
which type of muscle tissue is found in blood vessels?
Smooth.
Muscle's extensibility is its ability to
Stretch without being damaged.
How many main types of muscle tissue are there?
3.
A muscle's elasticity is its ability to
Return to its original length after contraction.
Which number indicates the epimysium?
Number 3.
An adductor is a skeletal muscle which
Moves only a limb towards the midline.
Which number indicates an example of cardiac muscle?
Number 12.
Which number indicates sorry. The outer layer of connective tissue which surrounds skeletal muscle tissue is called What's the answer? Nawawala yung nakamute. Ay, ikaw pala yun. Sorry. Maingay kasi. Sorry. Please unmute. Okay. Yan. Okay. Which number indicates the main skeletal muscle?
Number 2.
Which number indicates an example of skeletal muscle?
Number 10.
Number 11 is
Smooth muscle.
muscle around the eye.
Orbicularis oculi.
Main muscle involved with chewing.
Masseter.
Which type of muscle is also known as voluntary muscle?
Number 12 is skeletal.
Muscle's contractility is its ability to
Contract forcibly when stimulated.
What is the name of the large muscle at the back of the calf?
Gastrocnemius.
Which of the following acts as an antagonist to biceps brachii?
Triceps brachii.
Now let's go to the skeleton, full skeleton. Number 1 is number 1.
The skull.
Patella is what number?
Number 14.
Number 8.
The mandible.
The pubis.
Number 13.
Number 3.
Humerus. The humerus.
Pelvic girdle.
Number 11.
Number 2.
The clavicle.
The ribs.
Number 10.
Number 5.
The ulna.
Sternum.
Number 9.
Number 4.
The radius.
Tibia.
Number 15,
Number 6.
the femur.
Fibula.
Number 7,
Number 12.
the sacrum.
Number 12.
The ilium.
Ischium.
Ischium is number 5.
What does number 1 indicate?
The cranium.
Which number indicates coccyx?
Number 14,
Number 9.
scapula.
Lumbar spine.
Number 4,
Number 2.
the cervical spine.
Manubrium.
Number 8,
Number 7.
the patella.
Carpals.
13,
Costal cartilage.
number 10,
Number 3.
the thoracic cage.
Number 15.
The tarsals.
The phalanges.
Number 6,
Xiphoid process.
number 11,
Number 5.
the numerogenital joint.
Tibiofibular joint.
Number 9,
Number 3.
the temporomandibular joints. Temporomandibular joints.
Sacroiliac joint.
Number 12,
Number 1.
the coronal suture.
Suture. Number 14.
14 is tibiofemoral.
Talocrural joint.
Number 15,
Number 4.
the glenohumeral joint.
Sternoclavicular joint.
Number 11,
Number 10.
the acromyoclavicular joints.
Acetabulofemoral joint.
Number 13,
Number 7.
the regiocarpal joint.
Squamosal suture.
Number 2,
Pubic symphysis.
number 6,
Number 8.
metacarpophalangeal joint.
Number 1.
Skull, the skull.
Number 12.
The ulna,
Number 13.
the femur.
Scapula.
Number 9,
Number 6.
the ilium,
Number 7.
the sacrum.
Fibula.
Number 15,
Lumbar vertebrae.
number 5,
Radius.
number 11,
Rib cage.
number 4,
Number 8.
the cervical vertebrae.
Humerus.
Number 3,
Thoracic vertebrae.
number 10,
Number 2.
the clavicle,
Number 14.
the tibia,
Number 4.
the humeroradial joint,
Number 10.
the temporomandibular joint.
Tibiofibular joint.
Number 7,
Sacroiliac joint.
number 13,
Number 1.
the sagittal suture.
Tibiofemoral joint.
Number 15,
Number 8.
the talocrural joint,
Number 11.
the acromyoclavicular joint.
Lambdoid suture.
Number 9,
Glenohumeral joint.
number 3,
Number 2.
the Atlantoaxial joint.
Costovertebral joint.
Number 12,
Number 14.
metacarpophalangeal joint.
Pubic symphysis.
Number 6,
Number 5.
the radiocarpal joint.
Radius.
Number 11,
Number 10.
the rib cage.
Number 8.
The fibula.
Clavicle.
Number 9,
Femur.
number 14,
Number 13.
the ilium.
Skull.
Number 1,
Number 5.
the humerus.
Scapula.
Number 3,
Lumbar vertebrae.
number 6,
Number 7.
the sacrum.
Number 2.
The cervical vertebrae.
Number 15.
The tibia.
Thoracic vertebrae.
Number 4,
Ulna.
number 12,
Number 4.
the humeroradial joint.
Inferior tibiofibular joint.
Number 15,
Number 11.
temporomandibular joint.
Atlantoaxial joint.
Number 2,
Number 10.
the coronal suture.
Number 6.
Number 6, the tibiofemoral joint.
Palocrural joint.
Number 8,
Number 7.
superior tibiofibular joint.
Glenohumeral joint.
Number 3,
Number 9.
metatarso-phalangeal joint.
Lambdoid suture.
Number 1,
Acetabulofemoral joint.
number 13,
Number 12.
the metacarpal phalangeal joint.
Radiocarpal joint.
Number 5,
Number 14.
the interphalangeal joint.
Number 8.
The frontal bone.
Manubrium.
Number 11,
Number 1.
parietal bone.
Maxilla.
Number 9,
Number 2.
temporal bone.
Costal cartilage.
Number 14,
Number 3.
cervical vertebrae.
Sternum.
Number 12,
Number 4.
the thoracic cage.
Mandible.
Number 10,
Number 5.
the lumbar vertebrae.
Xiphoid process.
Number 15,
6.
sacrum.
Rib.
Number 13,
7.
the coccyx.
Sternum.
Sternum. Number 15,
1.
parietal bone.
Mandible.
Number 13,
2.
the occipital bone.
Cervical vertebrae.
Number 4,
Maxilla.
number 12,
Number 3.
the atlas.
10.
The frontal bone.
5.
The axis.
Thoracic vertebrae.
It's number 6,
Temporal bone.
Number 11.
7.
Lumbar vertebrae.
Manubrium.
Number 14.
8.
The sacrum.
Coccyx.
Number 9.
7. 7.
7 is temporal bone.
Mental foramen.
Number 2 is number 13.
1.
Is frontal bone.
Occipital bone.
Number 8.
2.
The nasal bone.
Sphenoid bone.
Sphenoid is number 9.
3.
The zygomatic bone.
Vomer.
Number 12.
4.
Maxilla.
Ethmoid bone.
Number 10.
5.
The mandible.
Supraorbital foramen.
Number 14.
6.
The parietal bone.
Lacrimal bone.
Number 15.
11.
Infraorbital foramen.
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 5.
Lumbar vertebrae.
How many lumbar vertebrae are there?
5.
Cervical vertebrae.
By number 3.
Number 10.
The 5th lumbar vertebrae.
Sacrum.
Number 6.
How many cervical vertebrae?
The cervical is 7.
2. Number 2.
The axis.
The
Axis po, Doc.
thoracic vertebrae.
Number 4.
How many vertebrae are fused together to form the sacrum?
There are 5.
Number 8.
The 7th cervical vertebrae.
Coccyx.
Number 7.
How many thoracic vertebrae?
There are 12 thoracic vertebrae.
1.
The atlas.
12 thoracic vertebra.
Number 9.
How many small vertebrae are usually fused together to form the coccyx?
Number 4.
4 vertebrae.
4
Number 3. Ngipon na ta.
First molar.
5.
First molar.
Number 5.
First premolar.
Lateral incisor.
Number 7.
Number 13.
The dentin
Third molar.
is number 1.
Central incisor.
That's number 8.
2.
Is the second molar.
4.
The second premolar.
Crown.
Is number 9.
10.
The neck.
Pulp.
The pulp is number 14.
6.
The canine.
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 Tama. The root.
Canine.
Root.
It's number 11. Number 11.
Tinutom tuloy. Nerve and blood vessels.
The pulp.
Enamel.
It's number 12.
Patella.
Number 8.
1.
The clavicle.
Tarsals.
Results number 15.
2.
Scapula.
Phalanges.
Number 13.
3.
Ilium.
Metacarpals.
Number 12.
5.
The ulna.
Ischium.
Number 6.
11.
The carpals.
Femur.
Number 7.
14.
Tibia.
Radius.
Radius number 4.
Number 9.
Fibula.
Humerus.
Number 10.
4.
The pubic symphysis.
Radiocarpal joint.
Number 12.
Number 5.
The metacarpophalangeal joint.
Tibiofibular joint.
Number 8.
Number 2.
Humerangial joint.
Acromioclavicular joint.
Number 9.
10.
The sternoclavicular joint.
Sacroiliac joint.
That is number 11.
3.
The acetabulo-femoral joints.
Tibiofemoral joint.
Number 7.
1.
Glenohumeral joints.
Talocrural joint.
It's number 15.
14.
Patellofemoral joint.
Carpometacarpal joint.
Number 13.
Number 6.
Interphalangeal joints. Joint.
Pisiform.
Number 2.
5.
Pisiform. Carpals.
Hamate.
Number 4.
12.
Trapezoid. Tripsoid.
Capitate.
Number 13.
1.
The lunate.
Lunate. Radius.
Lunate. Number 9.
14.
Sesamoid bone.
Metacarpals.
Number 6.
7.
The phalanges.
Ulna.
Number 8.
10.
Scaphoid.
9.
The radius.
Trapezium.
Number 11.
3.
Trichitrum.
Cuboid.
Cuboid is number 18.
22.
Yes, tarsals.
Navicular.
Number 17.
Okay. Number 17 is
Pillar. That
15.
15 is talus. The talus.
Phalanges.
Number 24.
16.
The calcaneus.
19.
The third lateral cuneiform.
Talus or talus.
Number 15.
18.
The cuboid. Cuboid
Second intermediate cuneiform.
is number 20.
Tarsals.
Number 22.
23.
The metatarsals.
24.
The phalanges.
21.
The first medial cuneiform.
Number 5.
The carpals.
23.
The metatarsals.
9.
The radius.
Cuboid.
Number 18.
12.
The tripsoid.
Trapezoid. 21.
21. The first and medial cuneiform.
7.
The phalanges.
16.
Calcaneus.
Metacarpals.
Number 6.
Talus.
Number 15.
Ulna.
Number 8.
Tarsals.
Tarsus. 22.
Hamate.
Number 4.
24.
Phalanges.
Radius.
Number 9.
Label number 1 indicates which part of the bone.
Metaphysis.
Bone on the left in the image is the
Femur.
femur. Label number 5 indicates
Diaphysis.
what do we mean by an articulation?
An area where bones contact each other.
A crest on the bone is
The prominent ridge.
what is label number 4?
Proximal epiphysis.
What is a condyle?
A large rounded articular process.
A canal is
A long tunnel-like opening within a bone.
label number 3.
Distal epiphysis.
Bone on the right is
Humerus.
articular process is
The projection that touches an adjacent bone.
what is label number 2?
Medullary cavity.
A small projection or bump.
Eminence.
Projection near to a condyle.
Epicondyle.
Small flattened articular surface.
The facet.
Facet. Diaphysis is what number?
Facet. Number 5.
Projection that contacts an adjacent bone.
Articular process.
Adjacent bones contact each other at
an articulation.
in the diagram, the metaphysis is indicated by
Number 1,
a long tunnel-like passage is called
canal. Canal.
okay, a large rounded articular process.
A condyle.
Okay, medullary cavity. What number? Allah.
Medullary is number 2.
Yeah.
Number 2,
Eminence. What is an eminence?
eminence, a small projection or bump.
The term epicondyle refers to
A projection near to the condyle.
distal epiphysis is indicated by
Number 3,
prominent bony ridge.
crest.
Facet
Crest.
is facet.
Facet is
Facet.
facet. A small and flattened articular surface.
Which label indicates the proximal epiphysis?
That is number 4.
What is a foramen?
Foramen. An opening within a bone.
Fossa.
A wide and shallow depression.
Shallow. Fovea.
Shallow.
What is the fovea?
Fovea. A small pit or depression.
Labyrinth.
Labyrinth is a cavity within a bone.
The line on the bone is
A long pain, a projection or ridge.
malleolus.
The protuberance of bone in the ankle.
Meatus.
A short canal open at one end.
Large projection or bump is known as
Process.
a branch from a bone is called
Ramos.
ramus. Cavity within a cranial bone.
Sinus.
A long thin projection on the bone.
That's called a spine.
Articulation between two cranial bones.
It's called suture.
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 A trochanter is
Tuberosity on the femur.
tubercle.
Tubercle refers the small and rough projection or bump.
What is a tuberosity?
Tuberosity, a rough projection or bump.
The diaphysis is
The shaft of a long bone.
what is an epiphysis?
The end area of a long bone.
A small pit found on the head of a bone.
Fovea.
Fovea. Cavity
Fovea.
within the bone.
Labyrinth.
A long thin projection on a bone.
Called line.
Which of the following is a protuberance in the ankle?
Malleolus.
Short canal in the bone, open at only one end. What is the answer? Ano na
Malul...
Huh?
Meatus po, Doc.
Yeah,
Meatus.
A process is
The fairly large bony projection.
ramus,
The arm-like branch of bone.
sinus,
A cavity within a cranial bone.
spine on a bone,
Spine. A long thin projection or bump.
what is a suture,
An articulation between the cranial bones.
epiphyseal plate,
Epiphyseal plate. An area of hyaline cartilage between the epiphysis and the metaphysis.
the head of a bone,
The proximal articular end.
metaphysis,
Metaphysis, the area of a long bone between the epiphysis and the diaphysis.
the neck of a bone,
The area between the head and the shock.
an opening through a bone,
Foramen. Foramen.
a broad, shallow depression.
Fossa.
Which of the following is a tuberosity on the femur?
That's trochanter. Trochanter bone.
Smaller projection than a tuberosity.
Tubercle.
Rough projection or bump.
Tuberosity.
The main shaft of a long bone.
Diaphysis.
End region of a long bone.
Epiphysis.
Area of hyaline cartilage between the epiphysis and metaphysis is called
Epiphyseal plate.
proximal articular end of a long bone.
That is head.
Area of a long bone between the epiphysis and the diaphysis.
Metaphysis.
Area between the head and shaft of a long bone.
Neck.
What do we mean by articulation?
Articulation, an area where bones contact each other.
Canal.
A long tunnel-like opening within a bone.
Prominent bony ridge.
Crest.
Eminence.
The small projection or bump.
Epicondyle.
A projection near to a condyle.
Thank you very much and congratulations. Okay, so very good job. Perfect lahat. Wow.